Hi, my name is Monica. I will be starting off our group semester project over Chapter 11, Employee Counseling, Well-Being, and Wellness. Our group is comprised of Melanie Flores, Carly Van Damme, Boston Crisp, and myself, Monica Alanis. We will begin with an overview of employee counseling programs. The counseling programs range from health risk appraisals to on-site counseling and stress reduction workshops, all to promote employee health. Programs can take the form of a one-time discussion, a series of sessions, or an ongoing organizational activity. I will be discussing the components of a typical employee counseling program. There are 6 factors or components that make up a typical program, and that includes problem identification, education, referral, counseling, treatment, and follow-up. The first component that I'll be talking about is problem identification. Problem identification usually involves the use of a screening device, such as a questionnaire or a diagnostic test. It also includes the training of employees and supervisors in the identification of the problems. I've also included Table 11.1 out of our textbook. It shows a screening device regarding alcohol abuse. It has questions. One of the questions is, on average, how often do you drink beer, wine, liquor, or other beverages containing alcohol? This is a screening tool used to determine the severity of a substance abuse problem. They can either be rated as a low risk or moderate or even high risk. The second component to a typical employee counseling program is education. This typically includes providing information about the nature, prevalence, likely causes, and consequences of a problem and different ways the problem can be prevented. An example is if an organization focused their education program on hypertension or heart health, they could provide pamphlets or lectures to raise employees' awareness of the problem and how it can be treated and prevented. The third component to a typical program includes referral and referral services. Referral involves directing the employee to the appropriate resources for assistance. For example, an employee who shows signs of cocaine addiction may be referred to a drug treatment facility that specializes in treating that particular addiction. I've included an example here of referral or hotlines for mental health and substance abuse programs. In this case, someone could contact someone at the Substance Abuse Treatment Locator at findtreatment.gov. The fourth component to a typical program includes counseling. This involves a person with whom an employee can discuss difficulties and seek further help if needed. Types of counseling can vary from a frank discussion with the supervisor about work-related performance issues or with a healthcare professional skilled in diagnosing and treating problems such as depression and or substance abuse. Depending on the counseling concept, then comes the treatment and intervention. Treatment includes the actual intervention to solve the problem. I've included an example of an intervention process, from learning the addict's behaviors, educating addict's loved ones, confronting the addict acknowledges lifestyle, and plans for their recovery. Treatment programs also may include less severe programs. For an example, a nutrition program may include cooking classes or the offering of healthy foods in the cafeteria and nutritious snacks in vending machines. The last concept we're going to talk about is follow-up. As with any other activity, some form of monitoring is needed to ensure that the employee is carrying out the treatment and to obtain information on employee progress. It's not really expected that every employee counseling program makes use of all 6 types of activities. It's all dependent on the resources available and appropriate responses to each problem. For an example, to address employee physical fitness, an organization may opt to build a fitness center or provide memberships to a local health club. An even less expensive option would be to make fitness information available and encourage employees to exercise on their own time. So who provides these types of services? Well, an organization may offer these programs or opt to contract it out to a third-party service. In-house programs involve hiring specialists such as psychologists or other trained health professionals. Contracting through a third party involves a local specialist or organization to provide the services. Either option does have advantages and disadvantages. And in the next slide, we will cover the advantages and disadvantages of in-house services. Some of the advantages and disadvantages of in-house programs include advantages such as internal control of the program, familiarity with the organization, such as policies and procedures, better coordination of treatment and follow-up, sense of ownership of the program, and greater awareness and credibility with supervisors. Some of the disadvantages discussed in our textbook include real or perceived problems with employee confidentiality, lack of resources, or reluctance of some employees even to use the services, or possible limitations in staff skills. Just like with in-house programs, there are some advantages and disadvantages of contracting these services for employees. Some of the advantages are organizations can rely on the services of trained professionals whose business is to treat the problem in question. Confidentiality may be a little bit easier to maintain in third-party services. Costs may be lower, better identification and use of community resources, and also some of the disadvantages are lack of on-site counseling, communication issues between the employer and the contracting service, or lack of knowledge of the organization and its employees. There are some characteristics of effective employee counseling programs. Some of these effective characteristics include top management commitment and support, a clearly written set of policies and procedures outlining the purpose and function of the program, cooperation with local unions, a range of care or referral services to community resources, a clear and well-defined policy concerning confidentiality of employees, maintenance of records for program evaluation, health insurance benefit coverage for services, and definitely family education. I'm now going to turn over our presentation to Carly, and she's going to discuss further the employee assistance programs.
Hello everyone, my name is Carly Van Damme and I will be talking about my part of Chapter 11's Employee Counseling, Wellbeing and Wellness, and I will be starting with my first topic of Employee Assistance Programs. For the first slide, we'll be going over Employee Assistance Programs, or EAP for short, and the history behind these programs. Employee assistance programs are job-based programs operating within a work organization for the purposes of identifying troubled employees, motivating them to resolve their troubles, and providing access to counseling or treatment for those employees who need these services. EAPs did begin programs for alcoholism in the 1940s, and they expanded about 30 years later to cover drug and other substance abuse issues. Since then, EAPs have expanded their coverage to help employees with mental health, such as anxiety, depression, eating disorders, compulsive gambling, and even financial problems, all of which are affecting their work. The number of people since the 1970s that are members of EAPs has grown drastically. In 2015, EAPs had nearly 5,000 members in over 30 countries, and approximately 33% of all private non-agricultural work sites with 50 or more full-time employees offer EAP services to their employees. Substance abuse programs are the programs that began in the 1970s, and in 2009 it was estimated that 21 1.8 million Americans were current illicit drug users, and the majority of these were either employed full-time or part-time. In 2012, approximately 17.3 million Americans met the criteria for an alcohol use disorder. And as much as 47% of industrial injuries have been caused by alcohol use, and companies have been estimated to lose quite a bit of money, such as $7,000 per year, for every employee who uses and abuses drugs and alcohol. And a Workplace Act was created in 1988, which is the Drug-Free Workplace Act, and it promotes drug-free awareness programs among federal contractors and grant receivers. And if any company needs to go to get more help, they can go to the Hazelden Foundation and the U.S. Substance Abuse and Mental Health Services Administration. Next, we will be talking about mental health programs and the types of mental health acts. The National Institute of Mental Health estimated that 43.7 million adults in the United States experience some type of depressive illness, that being 18.6% of the United States population. Within this total, 4.1% of American adults had serious mental illnesses that heavily interfered with life activities. These activities included eating, managing personal finances, and functioning socially with work, family, and friends. The issue of mental illness at work has been highlighted by 3 other U.S. federal regulatory actions. First being the ADA, or the Americans with Disabilities Act of 1990. This helps in the areas of psychiatric disabilities and addresses guidelines for employers who deal with the mental impairment of employees or applicants. Second is the Mental Health Parity Act of 1996. This states that private employers with more than 50 employees who offer mental health coverage must offer annual and maximum lifetime dollar limits equal to those for regular medical benefits. And third is the Mental Health Parity and Addiction Equity Act of 2008. This requires mental health coverage and equal to other forms of overage. Counselors in this industry see a lot, they help people with a lot, and they experience all sorts of emotional and mental health issues. This chart shows all the ones that they do see within the industry. One being individual adjustment problems, neurosis to psychosis. Next would be internal factors such as battering, incest, rape, or crime. Third, they see sexual problems including impotence. They see divorce and marital problems, depression and suicide attempts, difficulties with family or children, and even legal and financial problems. I have provided a knowledge assessment question, and let's see, based off all the information I just went over, if y'all can get this one correct. Which organizational act promotes drug-free awareness programs among several contractors? A. Mental Health Parity Act of 1996. B. Labor Relations Act. C. Drug-Free Workplace Act of 1988. And D. Americans with Disabilities Act of 1990. If you guess C. Drug-Free Workplace Act of 1988, you are correct. This program includes informing employees about the availability of drug counseling, rehabilitation, and employee assistance programs. The next section of Chapter 11 I'll be going over is employee wellness and health promotion programs. For this slide, we'll be discussing employee wellness programs or health promotion programs. These types of programs are activities that promote employee behavior and organizational practices that ensure employee health and fitness. These programs attempt to encourage individuals to adopt a more encouraging, positive lifestyle. While stress management is a component of health promotion programs, or HPP, these programs also deal with non-stress issues such as obesity, nutrition, and smoking cessation. There are 3 levels at which fitness and wellness programs can be implemented. Level 1 programs, they primarily cover educational activities and may not attempt to directly change employee behavior. And this level includes newsletters, posters, classes, and health screening. Level 2 programs are those that attempt to bring out direct behavioral change, and this can include exercise classes, fitness memberships, and physical work task classes. And Level 3 programs try to create an organizational environment that helps employees maintain healthy lifestyles, and this can include the Johnson & Johnson Health and Wellness and the Stay Well Company. Here I have listed 4 types of interventions that companies or industries offer. First is exercise and fitness interventions. These supply a range of services for employees, from jogging trails and on-site fitness centers to exercise breaks and company-sponsored sports teams or leagues, which is very stress relieving. Second is smoking cessation. These organizations have increased their sponsorship of smoking cessation programs to help employees reduce costs and provide a safer workplace. A survey was conducted of private work sites and discovered that 35% of respondents had smoking cessation programs. Third is nutrition and control weight interventions. Worksite weight control programs can be effective in helping participants achieve short-term weight loss, but their effectiveness regarding a long-term weight loss and their health and productivity benefits have not been well established. Fourth is control of hypertension. Approximately 32% of U.S. adults suffer from hypertension. This can lead to heart disease and also stroke. Hypertension workplace programs have been effective in reducing blood pressure and increasing participant knowledge. A benefit of $1.89 to $2.72 in reduced healthcare claims per dollar spent on running a hypertension control program has been reported. With going over information about employee wellness and health promotion programs, let's see if you can get the knowledge assessment question correct. Which technique is a part of a Level 2 employee health and wellness program? A. Newsletters, B. Stay Well Company, C. Health screening, and D. Fitness memberships. If you guessed D. Fitness memberships, you are correct. Level 2 programs are the programs that attempt to bring out direct behavioral change. They can also include exercise classes, memberships in fitness centers, and as the answer shows, fitness memberships.
Importance of smoking cessation. The Affordable Care Act requires employers and health insurance plans to cover preventative services at no cost to insurance plan members. Tobacco cessation treatment is a preventative service. Smoking cessation reduces risk for many adverse health effects, including cardiovascular disease, pulmonary disease, and cancer. Smoking is one of the most publicized health risks not only in society but in a workplace. The American Lung Association urges all employers to make sure their health insurance includes a comprehensive tobacco cessation benefit for all employers. The Affordable Care Act requires employee-sponsored health insurance to cover tobacco cessation. A cessation benefit should include the following: cover of all treatments recommended in the U.S. Public Health Service guidelines, which include medications on plan formularies and preferred drug lists, and covering of all 3 forms of counseling. Cover each medication for the FDA-approved duration of use. Cover at least 4 counseling sessions per quit attempt, and at least 2 quit attempts per year, but the more the better. Eliminate or reduce copays and other cost sharing on medications and counseling. Does not require prior authorization of treatments, and does not limit the number of times a person can try to quit in their lifetime. It also does not require stepped care therapy, which can force a patient to use a treatment they have already tried or that is not right for them. It also does not require patients to attend counseling to obtain medications. Counseling should be encouraged, but requiring it may discourage some people from seeking any assistance with quitting. Tobacco use is the leading cause of preventable death and disease in the U.S., making it critically important that prevention and cessation programs are available to help people break their tobacco addiction for good. Currently, 12.5% of the U.S. population are smokers. That's an estimation of 30.8 million adults in the U.S. Cigarette smoking remains the leading cause of preventable disease, disability, and death in the U.S., accounting for more than 480 deaths every year, or about 1 in 5 deaths. Quitting smoking is one of the most important actions people can take to improve their health. This is true regardless of their age or how long they have been smoking. There are a lot of reasons why someone should quit. Number one reason is it improves your life expectancy by at least 10 years. You'll get sick less often, your cholesterol overall will improve, you'll look younger, and you'll have more money in your pocket rather than paying for future expenses for better health. Evidence-based cessation treatment. Tobacco use and dependence often requires repeated intervention and long-term support to help patients quit. The report outlines an array of effective treatments and resources, including the following. Counseling and medication, which is effective when used alone, and using them together can more than double the chances of quitting. Combining medications compared to using a single form of nicotine replacement therapy. Combining long-acting nicotine replacement therapy with a short-acting nicotine replacement therapy increases the chances of quitting. There are tobacco quit lines, which is a proactive counseling from quit lines increase the chances of quitting when used alone or together with cessation medication. Text messaging and web-based cessation interventions can also help people successfully quit smoking. The best treatment for tobacco use consists of a combination of quit medication and behavioral therapy or support. However, the challenge in providing this best treatment lies in finding a way to personalize each person's quit plan while making support and medication convenient and available to them. Exercise and fitness interventions. Sufficient physical activity is linked with important health outcomes, including reductions in cardiovascular disease, diabetes, some cancers, osteoporotic fractures, depression, improvements in physical function, weight management, cognitive function, and overall quality of life. Despite this compelling evidence for the benefits of physical activity, healthy adults commonly get an inadequate amount of physical activity. As an employer, you can help improve the health of your employees and create healthier communities by promoting physical activity in your workplace and surrounding community. Worksite physical activity can improve employee health and save money. Workplace wellness program benefits. It increases employee productivity, reduces absenteeism, increases employee morale, and helps you attract and keep high-quality employees. On average, Americans who work full-time spend nearly 8 hours a day at their work site. Employers are in a unique position to promote physical activity and potentially affect the health of millions of working adults. Employers can encourage physical activity through multiple approaches, such as offering management support, access to facilities, and social support programs. Regardless of the size, resources, setting, or type of workplace, there are many ways to help the employees be more physically active. What can be done in the workplace to promote physical activity? Promote worksite programs and policies that support physical activity by providing access to facilities, locations, and programs that help employees be physically active. Use policies and incentives to encourage physical activity. Examples include offering flex time and paid activity breaks to employees and adding short bursts of activity or stretching into meetings. You can also provide discounts for off-site exercise facilities or active commuting options. You can set up walking and running clubs or competitions that encourage and motivate employees to meet individuals or team goals. You can also include intramural sports such as volleyball, sand volleyball, flag football, dodgeball, or soccer. Building a workplace health program should involve a coordinated, systematic, and comprehensive approach. A coordinated approach to workplace health promotion results in a planned, organized, and comprehensive set of programs, policies, benefits, and environmental supports designed to meet the health and safety needs of all employees. A comprehensive approach looks to put interventions in place that address multiple risk factors and health conditions concurrently and recognizes that the interventions and strategies chosen influence multiple levels of the organization, including the individual employee and the organization as a whole. Workplace health promotion programs are more likely to be successful if occupational safety and health is considered in their design and execution. In fact, a growing body of evidence indicates that workplace-based interventions that take coordinated, planned, or integrated approaches to reducing health threats to workers both in and out of work are more effective than traditional isolated programs. Integrating or coordinating occupational safety and health with health promotions may increase program participation and effectiveness and may also benefit the broader context of work organization and environment.
This is issues with employee counseling. First slide, effectiveness of employee counseling interventions. Anecdotes and testimonies make up a sizable portion of evidence of effectiveness for these treatments. It is challenging to do thorough studies on these issues due to a number of variables. First, organizations may be reluctant to provide researchers with access to necessary data to any counseling-related issues such as substance addiction and mental illness are personal in nature. Second, many of these issues make it challenging to define success and effectiveness. Third, the initial motivations behind an organization's intervention may have impact on whether research is conducted and how efficiency is measured. Offering a model that defines the data required for reliable assessment is one method to motivate corporations to assess their programs. Legal issues in employee counseling programs. Employee counseling programs are greatly impacted by the federal and state laws and regulations, particularly in the area of alcohol and drug misuse. Some advocates for employee counseling and well-being programs point out that a legal benefit to such incentives, noting that they assist the employer in complying with legislation such as the Americans with Disabilities Act of 1990 and the Rehabilitation Act of 1973. Employees with disabilities may only be fired for poor work performance according to the Rehabilitation Act, which is applicable to federal contractors and organizations that receive funding from the government. According to the ADA, businesses are required to make reasonable accommodations, which roughly speaking includes modifying workplaces, resources, processes, and occupation. When the company prepares and conducts any counseling or wellness program, legal problems should be taken into consideration. Whose responsibility is employee counseling? Employee well-being is responsibility shared by employers, unions, managers, HRD experts, along with employees themselves. The improvement of employees' mental and physical health will have a substantial positive impact on business. Supervisors are crucial to the success of any employee counseling program because they have regular contact with workers, are in charge of their growth and assessment, and ultimately are accountable for their performance. Ethical issues in employee counseling. Confidentiality and the nature of participation are the two moral questions pertaining to employee counseling services that require discussion. To put simply, all records of program usage should be kept in the highest confidence, kept distinct and isolated from employees' personnel file, and only be made public with the full employee's agreement. Employees should be free to live as they choose and shouldn't be coerced into making changes to their conduct that aren't necessary for the performance of their employment. Unintended negative outcomes of employee counseling programs. Participating in counseling or fitness programs has potential to have unforeseen negative effects. This is especially true of programs that promote good health. Knowledge assessment. True or false? Supervisors play a role in the employee's well-being or counseling program. I will give you 5 seconds. This answer is true. If you said true, you have got that correct. Stress management interventions. Any activity, program, or opportunity started by an organization that focuses on lowering the presence of workplace stressors or on helping people lessen the negative effects of exposure to these stressors is referred to as stress management program or interventions. Defining stress. There are three primary elements that make up stress. A stressor is an external force that has an impact on the person. The person's emotional or bodily reaction to the stressor, and in some instances, there may be a connection between the stressor and the person's reaction. How a person cognitively assesses stress can have a significant impact on how that stress is felt. Whether a stressor has a negative impact on performance depends on how individuals handle stress themselves. A model for stress management interventions. Educational interventions. The goal of an educational intervention is to provide the worker with knowledge about causes, symptoms, and solutions to stress, as well as strategies for preventing stressors and improving stress management. Skill acquisition interventions. Employees can learn new coping mechanisms to deal with stresses affecting their life, and performance via skill acquisition interventions like assertiveness training or time management, which can help the impacts of stress under control. At the moment, the majority of workplace SMIs concentrate assisting the person in reducing stress through practices of meditation, exercise, and time management. SMIs should, however, also concentrate on aspects of the working environment that lead to stress. The effectiveness of stress management interventions. When driving an organization's stress management effort, here is a simple recommended guide. Determine what precisely is going on with the employees rather than broadly talking about stress. Evaluate what indications of the problem exist and how pervasive they are. What will be effective in a certain company? What area should the interventions focus on? What connections does this intervention make to other organizational and human resource policies? Does the organization need to make any other changes first? What will be reviewed, and how will the results inform future actions? One more true and false question for you guys. Educational interventions is when employees can learn new coping mechanisms to deal with stresses affecting their life and performance. True or false? I'll give you 5 seconds. This is false. If you said false, you got it right. This is skill acquisition intervention is when employees can learn new coping mechanisms to deal with stresses.